And the diagnosis that you got was?
There was something going on, I guess, when my head, this thing happened with my head. It was pulled off of the first vertebrae, the atlas.
Right.
And subsequently caused the jaw, the whole head, to shift. So everything was sitting to the right, and everything like a train, like a gyroscope, it was collapsing.
So temporomandibular joint syndrome, meaning that your jaw was
My jaw
off.
was out of whack, but my trigeminal nerve was being compressed all day long.
Which is, people talk about that, you know, being a suicidal type of pain. I've never experienced it, but it sounds like that's almost where you were at.
I was. It was brutal because the pain was so intense, the symptoms were so strange, and it just got worse until I would wake up in the middle of the night and say to my husband, I can't do this anymore.
And what's so interesting and why I'm so happy you're here is sometimes the best solution is in many ways the simplest, and a device changed your life.
Oh, it did. It's called the Gelb device. It's a tiny piece of plastic. Looks like a retainer, but it's not a retainer. It looks like this, except mine is very designed for me. It's built up on the edges so that my teeth never come together, and it makes the jaw shift to the left.
To align it?
Exactly.
I do want to bring into the conversation the individual who helped out TMJ specialist Dr. Michael Gelb from White Plains, New York via Skype. And Dr. Gelb, I will confess, when I started hosting this show, and we had a few success stories with treating TMJ for what seemed like completely different problems, we had a number of patients, their successes were remarkable, and I became a believer. If someone at home is watching, how would they know if this could be a potential solution?
One very simple technique is to put your fingers inside your ear, bite down. You shouldn't feel any clicking, popping, pain. If you feel compression, it's not a good sign.
And I have a question, Dr. Gelb. You know, in Janet's case, she had been seeing a chiropractor, which can be incredibly helpful for a slew of musculoskeletal issues. Do you think that acute pop that she heard was something as a result of the chiropractic treatment, or do you think that was a progression of the TMJ, you know, a true and unrelated, or do you think one was related to the other?
I think the traction, you should never do traction where something is pulling your chin back.
Exactly.
Anything that pulls the chin back can exacerbate the joint. It can cause a popping, clicking, and I think in Janet's condition, her pain was so severe, couldn't sleep through the night, and she was becoming worse and worse.
I would be
it's
driving.
remarkable how, you know, Dr. Gelb, your solution has worked for her. We can see up close and personal how happy she is. She is a happy patient. Thank you, sir, for your help. And describing this. So, are you able now? I mean, you're smiling. Are you able to live your life again, enjoy your family?
It's not perfect. What we're trying to figure out is some way to make it permanent, which would mean probably
Surgery
doing
on
some
the
sort of
TMJ?
surgery on the, not the TMJ, it's the trigeminal nerve for me that is being compromised. And there are times where, you know, like this morning, I wake up and I take the guard out and I still feel that strange wonkiness. And you have to be careful when you're driving. But in pain management, you know what they say? How many good days are you having as opposed to bad days? You know?
We are just so happy that you're having some good days.
Thank you.
What a pleasure. We'll be right back.